Ministry of Health and representatives of the United Nations and the United States government take journalists around the National Ultra-Cold Chain store where the recently arrived Moderna COVID-19 vaccines are stored. The Director General of the National Primary Healthcare Development Agency confirms that 4,080,000 doses of Moderna were received from the U.S. government and stored in these ultra-cold stores. But the vaccines will not be deployed to states immediately, as the government awaits further certification by the National Agency for Food and Drug Administration and Control, NAFDAC.
Once we get clearance from NAFDAC, we're going to be sending the vaccines directly to the states, and then the states can start the process of deploying to the LGAs and the health facilities so that Nigerians can begin to get these vaccines as soon as possible.
The Moderna vaccine has a maximum shelf life of 5 to 6 months and must be stored in a minus 20 degrees Celsius temperature.
What's the expiration date for these vaccines that we just received?
It's the end of December. Yeah? End of December and end of January.
Beyond the issue of storage and lifespan, officials also clarify if the vaccine can be combined with the AstraZeneca vaccine, as well as the potency of Moderna vaccine over the Delta variant.
For the Delta variants, what the data is showing us is that those vaccines are really effective against severe disease and also hospitalization. So we know that for the Delta variant, so we're good to go.
Additional doses of the AstraZeneca vaccine will be coming to Nigeria, and we'll be able to cater for those people who have taken their first doses. We'll give them second doses, but beyond that, there will be additional opportunities for people to be given the AstraZeneca vaccine, if that is what their preference is.
The federal government officially ended the first phase of COVID-19 vaccination exercise 3 weeks ago, after the country exhausted the 4 million doses of AstraZeneca that was received from the COVAX facility in March this year.
Dr. Faisal Shuaib is our next guest, is the Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency. As you did see in that report, his agency was responsible for receiving the newly donated vaccines, which were just given to us by the United States government, the Moderna vaccines. Just a little over 4 million of them arrived the country Sunday night and were in the possession of the MPHDC. I hope I'm getting the acronym right.
MPHCDA.
It's a mouthful.
Close enough.
And you were responsible for receiving that. But right now we understand you cannot just dispense immediately. There's still some protocol that needs to be followed. Quickly put us through the protocol that needs to be followed, and then we'll ask how this is supposed to go around.
So once we get vaccines from any source, we have a regulatory authority in Nigeria, NAFDAC, that is responsible for doing some final checks. So, of course, before the vaccines arrive in Nigeria, they will have gone through all of the dossiers, right, all of the files to look at all of the clinical trials and all of the checks that must have been conducted to ensure that these vaccines are safe and efficacious. Coming into Nigeria, these tests are sort of standard tests that are conducted anywhere in the world. Even for our routine immunization vaccines, they will have to check to see the consistency of the vaccine, the labeling, the pH, for example, the osmolality, just to make sure that what has been presented in documents submitted is exactly what the vaccine is all about, apart from the physical, but also some of the chemical properties. And this is something that NAFDAC has done over the last decades, and they've done an outstanding job so far.
Well, this has arrived just in the nick of time, it would seem, because just yesterday also, the federal government did declare that it was seen that we're in the third wave of COVID-19, and the Delta variant is of particular concern to the federal government. So when we received the first batch, there were concerns, even though it was not as much as this one. It was 3-point-something million, close to 4 million, but not quite 4 million. There were concerns as to, one, how it was going to go around, considering our population and the fact that you have to do a double immunization for the vaccine to be effective. There were concerns about that, and then we were able to, I think, streamline or state clearly just how we wanted to dispense that particular product. One, to eliminate vaccine, well, eliminate, maybe reduce, it would be the key word now, vaccine hesitancy, and also to ensure that we protect the most vulnerable, especially our frontline workers. So what's the process for this one now? Do we have that spelled out, this over 4 million Moderna which we have received?
Right, so in the second phase of our vaccination rollout, we're sending out guidance that anybody who is 18 years and above can register online to schedule their vaccination to the designated health center or hospital of their choice. They can also schedule exactly what time they would like to have this vaccine. And they can also do a walk-in, right? Because not everybody has access to the internet, and not everybody has access to phone, but of course, majority of Nigerians do have this kind of access. And they can just walk in and get the jab. Unlike the first phase where we insisted that you had to be either a frontline health worker, a first responder, you had to be somebody that was particularly vulnerable, or somebody that was likely to come in contact with the virus. This time around, we've seen that in the first phase, we've pretty much captured most of those populations, and now it's anybody who is 18 years and above that can access the vaccine once we roll it out.
How was the reception for the AstraZeneca? That we had fears initially that, you know, there was going to be some hesitancy on the part of our population. How did that go?
I think it went pretty well. I mean, we still have challenges with misinformation and disinformation. I'm sure you've seen a lot of the, fake videos that are going around in the social media. But pretty much when we started, just like you said, as many as 30% of people said they were going to take the vaccine. Most Nigerians were sitting on the fence because they didn't have adequate information about the nature of these vaccines and whether they were going to have untoward adverse events. But as we monitored through surveys, we began to see a gradual climb up to the extent that in some communities, up to 90%, 95% of individuals said they would accept the vaccine, especially now that we've vaccinated, over 2 million people, and it is very evident that nobody died from direct causes resulting from the vaccine, and that the side effects from the vaccines, which are actually there, are not, life-threatening. So we've seen that people are gradually accepting the vaccine. Of course, we cannot avoid a situation where a few people, who are especially cynical, will continue to hesitate. But it is our responsibility as the public health practitioners to continue to strive to provide the correct information, working, of course, with the media to ensure that Nigerians have the correct information. And we're confident that, just like we've seen a gradual improvement in accessibility during the first phase, that by the time people start taking the vaccine and see that their neighbors, their friends, are doing quite well, that we will see a very successful rollout as well.
The first batch you received was AstraZeneca.
Correct.
The second batch is Moderna. You have put out a warning that we should not mix AstraZeneca and Moderna. In other words, if you took AstraZeneca for your first dose, make sure AstraZeneca is your second dose. Is that correct?
That is correct.
Moderna is also going to be 2 doses. Is that correct?
That's correct.
In other words, you'll have to take 2 for the vaccine to be effective. Is there any difference, any major difference between these 2 vaccines? Because one of the questions that people have is how this is going to be, assuming they were to leave the country for whatever reason or have to go abroad and come back. Is there a type of politics between what vaccine is acceptable abroad and what vaccine isn't? Are we differentiating in Nigeria what vaccine our citizens receive?
Not really. Any vaccine that you take is going to be safe and effective, right? And the reason why we're saying if you start with a particular one like AstraZeneca for the first dose, that you should also take AstraZeneca for the second dose is because these vaccines have different ways of acting, right? They have different modes of eliciting antibody response, right? So you want that once you have taken a particular vaccine, that your body recognizes, the way to respond to that vaccine and provide protection. If you bring another vaccine, right, then it sort of has the potential to confuse the body. That is what we know for now. But as we begin to collect more data around the modes of actions of these different vaccines, then it is possible that in the future, when we have more evidence, it may be possible to actually combine these vaccines. So last week, for example, there is the SAGE, which is an expert committee that looked at the data and recommended that it is possible to combine AstraZeneca and the Pfizer vaccine. We don't have the Pfizer vaccine right now, but that has come from several months, large data that has been examined, and the consideration is that it is possible to combine those two vaccines. But for now, there is no guidance that says that you can combine the AstraZeneca and the Moderna vaccine. But really, these vaccines are exactly the same. And if you take a Moderna first dose in Nigeria and you have to travel abroad, like you cited, it is possible to take the second dose of Moderna anywhere. And it's the same situation. There were Nigerians that actually took the AstraZeneca vaccine as their first dose abroad. And when they came back home, they did not have the opportunity to go back at the time that they were supposed to take the second doses. And we did make the announcements that they could come to our health facilities and we will give them the vaccines for their second dose. And we did vaccinate with the second doses. So it's exactly the same vaccines across the world.
I noticed that you mentioned Moderna, Pfizer, and AstraZeneca. For the Johnson & Johnson, which is just a single dose, there have been huge questions. I do not know if you've been monitoring what's happening in South Africa. I imagine that you have been. But there are those who now say that, we took the Johnson & Johnson vaccine and it's not regarded as vaccination. What are your thoughts on that? Have you heard that? No,
I've not heard that there's any information out there. But people can say anything. It doesn't necessarily mean that it is factual, right? The Johnson & Johnson vaccine is one of the most effective vaccines. As a matter of fact, this is why in South Africa, it is being given to protect against the Delta variant. You recall that initially, the South Africans started with AstraZeneca, and then they looked at some studies and, came to the conclusion that the AstraZeneca might not be very effective against the strains that they had in South Africa. And so they switched to Johnson & Johnson. And I've seen that in the last few weeks, they've really ramped up their vaccination across South Africa. And they're using the J&J vaccine. And we're expecting that we will get the same vaccines in September.
Okay. So when you think of, if you think of the fact that, we're ramping up our vaccination drive, and it would seem that you're getting some support from the state government. I imagine now that even though all the vaccines we have are in our central storage here in Abuja, you hope to distribute them to the states. You have received some support from some state governments by that time, at least even if it's not monetary, I imagine, or logistics-wise, at least the drive to try and get citizens vaccinated by a lot of the state executives, publicly taking the vaccination in open was also in a bid to support the drive of the federal government. How do you intend now to still distribute these ones for those who will be expecting them in the different states? Were some states asking for far more than you could give them at the first round?
Actually, that is not our experience. What we have seen, across the country is that governors are really excited. I don't want to name particular governors, but I've had multiple calls from governors asking when their vaccines will come, that they are ready to receive the vaccines. As a matter of fact, yesterday, I got a call from one of the governors in the South-South zone who said he's actually in the middle of a meeting with his immunization team, trying to strategize to make sure that some of the mistakes that they made in the first round are not repeated. But also beyond that, to make sure that the vaccines get to all the areas, especially the riverine areas that tend to be hard to reach. And we've gotten a lot of support from the states. State governors are releasing, funds, despite, how difficult it is financially for them. They're making funds available, and they're collaborating with us. Yesterday, we had a meeting with executive secretaries of the state primary healthcare boards that are responsible for this vaccination rollout all the way till past 10 p.m., right? So we're getting the kind of support that will be required. In the next couple of days, once we get the green light from NAFDAC, we hope to start transporting the vaccines to the states. We're working with Kakovic to ensure that the vaccines are airlifted to the states that have airports. And for those that do not have airports, we're going by road, making sure that we have security support, because these vaccines are very, very vital, right? Even with your money, if you go to the global markets, you cannot find them. So these are very, very precious tools that we're going to be using for protecting our Nigerians. Once they get to the subnational level, the states, we already have deployed 37 ultra cold chain equipment to the states, 36 states and the FCT, so that they are ready to accept these vaccines. And then at the subnational level, because this vaccine has the unique ability to be kept between +2 and +8 degrees Celsius for up to 30 days, even though it requires ordinarily ultra cold chain equipment, ultra cold chain conditions of -50 degrees Celsius to -15 degrees Celsius. It can still be kept within the regular refrigeration of +2 to +8 for up to 30 days. So in the interiors, we can keep those vaccines for 30 days before we make sure that they are completely utilized. So there's a lot of excitement from the states, especially because of the third wave. And we're hopeful that even with this round, the absorption from the states will be much better than in the first phase.
Let me quickly flip this to my colleague in Lagos, Ayo.
Well, thank you, Markwe. Doctor, first of all, is it safe to assume that the high-risk states, the states classified as high-risk, will get any form of priority treatment in this disbursement of vaccines?
Yeah, absolutely. So we're looking at a number of parameters, right, to decide the volume of vaccines that will go to the state. Without a shadow of doubt, Lagos State will be getting the highest quantities of vaccines. We're looking at the epidemiology of the virus in Nigeria. We're working with the NCDC, the Federal Ministry of Health, and then looking at the data from the first phase in determining the states that are priorities. And yes, those states that are red alert states, as determined by the Presidential Steering Committee, are going to be prioritized for larger volumes.
Okay. Well, there was something you said the other time. I just wanted to get a little bit of clarity. When we say that AstraZeneca vaccination should not be mixed with Moderna, could you tell us if there are consequences if anyone should say, look, vaccine is vaccine. After all, I can take any variant of paracetamol that I want. It's generic, okay? Produced by this or produced by that. It's all the same. What are the consequences if anyone should say, look, it's the same thing. I take AstraZeneca 1 and I take Moderna 2. What are the consequences?
So first and foremost, the guidance to the health workers is that you should not mix, right? So I do not foresee a situation where anybody will have access to the vaccines and then sort of experiment on themselves. You say, I'll just take the vaccines in whichever way I want in an interchangeable fashion. The guidance is very, very clear. But because we don't have enough data on what the consequences might be, it is not advisable that people do this. Maybe in further down the road, when we have additional data, then we'll be able to provide additional guidance, right? So the reason why we say you should not mix and match these vaccines is because we really don't know what the results might be. And some of the adverse effects might be severe enough and probably life-threatening, right? This is why we will say just don't try it until we get adequate information about what the reaction will be. And this is in line with the pattern of what we have done in Nigeria, that we are very careful and we prioritize the safety of all Nigerians when it comes to the vaccinations. We're not going to be taking any chances. And that is why we have provided the guidance to health workers that you do not mix AstraZeneca and Moderna, because we do not have data to support such actions.
Well, you, of course, are aware, Dr. Shuaib, that resident doctors are on strike. Is this going to have any significant effect? Is there going to be any significant impact of this strike on dispensing the vaccines across the nation?
The resident doctors are a part of the health sector, and any disruption of services in the health sector will affect all the services that are provided within that sector. Immunization is given from the primary healthcare centers to the secondary and the tertiary healthcare centers, and the resident doctors are a part of this health system. So we are hopeful that this strike that they've called will really not last for too long, that the negotiations that will take place will lead to a speedy resolution of the differences.
So let me ask you now where you've already told us how this is going to be distributed across the state, but what big battles do we still have ahead with misinformation, especially from some states we see have not been quite receptive to COVID-19 protocols, and even the citizenry are still in very big doubt as a result of social media?
I dare say that the biggest challenge that we face now is confronting misinformation and disinformation, like you've mentioned, and we're working at the Presidential Steering Committee, the Federal Ministry of Health, and the partnership with our donors and our development partners to figure out ways of making sure that we reach people in the grassroots, people who do not have access to information. Information is power, and that power is what we want to deliver to the hands of all Nigerians about the safety and the effectiveness of the vaccines, that they should look closely at people who are spending their time to disinform them about the vaccines, that it is not correct. This is why a few weeks ago, if you watched our press conferences, we took careful time to actually provide information to debunk all of these conspiracy theories. So this is something that we're working with the Federal Ministry of Information, the National Orientation Agency, non-governmental organizations, to see how we can also ramp up our ability to communicate. I am clear in my mind that most Nigerians are rational, and that if we do the great work of getting the information across to them, working with the media, in different forms, that Nigerians will accept this information and know that these vaccines can protect against COVID-19. And of course, that there's no longer any shadow of doubt about the fact that COVID-19 is real. I know that there have been challenges in some states in terms of the narrative around COVID-19. Again, it's a question of ensuring that those debates occur. This is why we're in a democracy. This is why there's free speech, that people can have different contrary opinions, but it is also our responsibility. It behoves us to provide them with the correct information and hope that they're able to review this information and come to the logical conclusion that COVID-19 is not a hoax, that it exists, and there's a vaccine that is effective to protect, especially against severe disease, hospitalization, and death.
Herd immunity is the goal. For those who have already received the vaccine and who are still wondering why they have to, stick with non-pharmaceutical procedures, COVID-19 protocols, what do you have to say to them? Because some people thought, okay, as a result of my having taken the vaccine, I wouldn't need to wear a mask anymore. And they found out that they still have to. What do you say to them? What would you say is the benefit of having gotten vaccinated?
Well, the first benefit there is that evidence shows clearly that when you get the vaccine, you are protected from severe disease, hospitalization, and death. So even in Lagos State, preliminary analysis in Nigeria shows that most of the people who are dying or are having severe disease are those who are unvaccinated. Globally, in the United States, the COVID-19 pandemic is now a pandemic of the unvaccinated. So when you get vaccinated, one thing that you can be sure of is that you have cut down on the chances of dying from COVID-19. COVID-19 vaccination will protect you against those outcomes. But when you wear a mask, you do two things. You also protect yourself from the chances of getting the mild form of the disease. Our data still suggests that you may still transmit the disease. So by wearing a mask, you also protect those people around you who may not be vaccinated yet for one reason or the other. For example, there are people who have contraindications to vaccination. So when you wear a mask, you protect yourself, but also protect your loved ones from COVID-19 disease. When we're able to achieve herd immunity, then it makes it, at that point, it becomes possible for us to do away with the masks, right? But until we achieve herd immunity, where we'll be able to get adequate numbers of people vaccinated, we have to continue to wear masks to protect ourselves and our loved ones.
Well, at that point, we have to say thank you very much for coming on Sunrise Daily this morning. Dr. Faisal Shuaib is Executive Director, Chief Executive Officer of the National Primary Healthcare Development Agency. Thank you for coming on Sunrise Daily once again.
Thank you for having me.